Okay, we have Meredith Witzel with CareWorks Comp, and she's going to tell us a little bit of the benefit of belonging to the chamber and what workers' compensation benefits you can receive from that. So Meredith, go right ahead and let us know what you guys have.
Okay, perfect. So, well, of course, good morning, everyone. Um, my name is Meredith. I am a program manager at CareWorks Comp, and we serve as the Cambridge's premier third-party administrator for workers' compensation. It's actually one of their member benefits. And if you're not familiar with us at CareWorks Comp, we help reduce employers' risk and get people and organizations back to health, work, and productivity. One of our main focuses is really promoting safety and being the employer's advocate when there is a workers' compensation claim. So we're really trying to protect their best interest, especially financial. And a lot of times that goes hand in hand with claims administration. So workers' comp, of course, is an important topic for many different reasons, but one, because it affects most all companies. Anyone that employs even one person has to have workers' compensation insurance and coverage. And of course, a focus on safety is important. But recently, with the launch of the MIWA programs, I'm not sure if everyone's familiar with that, sole proprietors haven't always had to have workers' compensation coverage. But if someone wants to be a part of a MIWA program or these multiple employer welfare arrangement programs, they do have to have workers' compensation insurance, even if they're a sole proprietor. And so in the past, that's not something that the Bureau has required, but the MIWA program requires it. And so basically the reason that is because with the MIWA programs, these are private insurance companies and helping employers save on their private insurance. And so they don't want to, of course, be responsible for a work-related accident. So they want you to file that workers' comp claim through the workers' comp system, not through the private insurance. So that's their way of kind of delineating that. And so before we get started, I wanted to share some updates that the Bureau has had. They've made a lot of changes when it comes to workers' compensation during the coronavirus pandemic, and so I wanted to share those with you. The first being premium installments. So I know this isn't on here, but for March, April, May, June, July, and August, premium payments were deferred, meaning you didn't have to pay them by your scheduled due date. You have an installment schedule that comes in May every year that tells you when your premiums are due. And basically what the Bureau is saying or was saying is that you can defer those until September 1. And I mention this just because if the Bureau is deferring these kinds of premium payments, we're still in the midst of a pandemic. So deferments could be something that's on the table still. We haven't heard of any talk about them deferring any other premium payments at this point, but it's something that certainly could happen. And so what that means and why that's important is because if you're in a group rating program where you're saving on your workers' comp premium payments, the Bureau is not going to lapse or cancel coverage during that premium deferment time. And a lot of times, lapses are accruing just as soon as the Bureau doesn't receive your payment for your premium. So that's something that they decided to relax during the pandemic as well. And again, that was for just that earlier time frame. We don't know if premiums are going to be deferred. Lapses too would be for, of course, after September. So they said that during the deferment from March until August, they're not going to be lapsing coverage. It's certainly possible today, but again, those premium deferments and lapses could be forgiven again or deferred again in the future. So keep that in mind. Also, safety education. This is something that if an employer is in a group rating program, they have to meet a safety requirement. And so for the 2019 policy year, the Bureau basically waived that and said that employers don't need to worry about completing the safety training for claims that happen within the green year for the 2019 policy year. So the green year for the 2019 policy year was July 1 of 17 to September 30th of 2018. So the Bureau waived that, which is really great. You know, we've all been trying to work from home, figure that out, which is been challenging at first. And then also, and probably the most exciting news, is that Governor DeWine, I know that this says proposing, but recently came out that they are actually giving another $1 billion back dividend check. So that means that the Bureau is going to be reimbursing you 100% of your 2019 premiums. Those dividend checks are set to be released this month in October. So just make sure you're cashing your checks. You see a lot of times that these dividend checks go uncashed because people don't think that it's real or something like that, but these are real. This is real money. This is yours. And again, just another way that Governor DeWine is really trying to ease the pandemic on employers. I mentioned this was the second one this year. There was another dividend check that went back to employers in April. That was for $1.6 billion, and that equated out to be 100% of your 2018 premiums. So they're giving a lot of money back. Last I heard, when it was when we talk about the surplus fund and how much money the Bureau has, to pay workers' comp claims, it was $11 billion. They have a lot of money. There's a lot of workers' comp claims that they're paying, so keep that in mind. But there's also, they have a lot of money that they can help employers with right now. And I think they're really doing everything that they can as far as giving these dividend checks back. So 1.4 billion of that dividend check back in April was given back to private employers, and then about 200 million of that was given back to public entities. And something else I wanted to share with you as it relates to the coronavirus. The latest news that we received from the Bureau was just back in late September, and they basically said that they are not sure what they're doing with the workers' comp claims when they are COVID claims. So they're not sure if they're going to be charging those to the employer's experience or not. So I wanted to share some information with you. This is a bit outdated, but it is the most recent information we've received from the Bureau. And this is the number of COVID claims that have been filed through the workers' comp system in Ohio. And I thought it was just interesting. And so I wanted to share with you some of that information. So there's been a total of 828 workers' comp claims, COVID claims filed in Ohio. Again, this data is from end of July, so that is a bit outdated. This includes self-insured employers and also private employers and public employers. This is all the data. Of the private and public employers, which I believe will be most of the Cambridge Chamber's workers' comp members, or not even workers' comp members, but members of their chamber, most people are going to fall into the private or public entity. There have been 213 claims accepted into the Bureau. So basically the ones that the Bureau said, okay, we're going to cover these. These are work-related COVID claims. We have some that have been denied and dismissed, and some that are pending. So pending, they're just waiting on some more information. They haven't made their determination yet. But when it comes to the denied and dismissed for private and public employers, you'll see that there have been 81 that have been denied and 201 that have been dismissed. So denied claims could be those that didn't have the COVID-19 diagnosis code on it. Maybe it was missing something, so the Bureau denied it. There are some claims that have been dismissed, and sometimes there's a lot of errors when it comes to workers' comp and filing those claims. Employees maybe think, maybe they hand them their workers' comp insurance information rather than their health insurance, their private insurance information. So COVID claims could have been dismissed, basically needing to, that employer or employee would need to file with their private health insurance company. So that is a lot of data there. And we can probably only imagine that this data is increasing. And I've shared this information with you because we don't know if this is going to be charged to an employer's experience or not. And as we all can imagine, COVID claims are expensive. And your premiums as an employer are based off of the cost of claims, max value claims, how many claims you have in your experience. And so I wanted to share this information with you because it could be helpful in just making sure that you're managing COVID claims and any claim really, really tightly and really well, and that you're working with a great partner to do those things. Something else that was interesting, the Bureau did delineate how many of those claims, of the 828 claims that were filed, how many of those were with healthcare and first responders. And we actually see that 655 of those were with healthcare and first responders. And then they have this other category, all other. And so that could be any industry group, manufacturing, construction, restaurants, but again, all work related. So I thought that was some good information that I wanted to share with you. Let's see if I can get back to my PowerPoint. Can you all see the PowerPoint right now? Okay, great. So now I thought that we'd talk a little bit more about what a third-party administrator is and the benefits of having a TPA, as well as what a TPA is not, because we're easily confused. So a third-party administrator is basically an agent that the Bureau of Workers' Comp, many of you probably know, we're a monopolistic state, so the Bureau has the ultimate say-so on how the system is set up. So the Bureau has allowed third-party administrators, or TPAs, to work with employers in conjunction with a certified sponsor like the Cambridge Chamber to provide workers' comp savings and help with claims management. It's a very complicated system if you've ever had a workers' comp claim, and so it can be very challenging, and so it's nice to have an expert on your side. So when it comes to third-party administrators, we are not required. You don't have to have an agent or a person that helps you with workers' comp claims. A lot of employers choose to have a workers' comp third-party administrator just because it makes everything a lot easier. There's also significant savings that employers can see on their group rating program, through group rating programs, and on their premiums that they pay to the state, but we are not required. You do pay for our services. So these premium savings programs and claims administration and being your advocate, there is a cost associated with it. And if you're in a premium savings program, it's typically a lot less than what you'd be saving with us. So it's a really good deal for employers. And again, we are the employer's advocate. So we're looking out for your best interest. A lot of times that comes down to finances and claims administration and management. And then I wanted just to take a moment to talk about, who we're not. And we are not the managed care organization. We get a lot of times we get confused by employers and say, oh, I already have a TPA. And then they tell me the name of their managed care organization. And it's not the same. The managed care organization is something that is required. The TPA is not required. You never pay for your managed care organization. You're never going to see a bill from them. The premiums that you pay to the state are actually going to cover your premiums to the managed care organization. So you pay for them, but indirectly through your premiums. And their whole purpose, they're an extension of the Bureau, and their whole purpose is to get injured workers the care they need and to bring them back to the workplace. So that's their mission. Whereas with the TPA, we're your advocate looking out for your finances. So very, very different, but easily confused. I'm just giving that as a high level. If we get, more detailed, there is some more information and maybe some more crossover where it could get confusing, but those are the main differences. You pay your TPA for savings programs. So our responsibilities, as you'll see here, include claims administration and claims management. So we're looking out for the employer's best interest. We do not want a claim to impact an employer as much as it could. So claims administration is huge. We are the largest third-party administrator in the state of Ohio. So we handle a lot of claims and we know what we're doing, and we do claims management really well. There's not a whole lot of claims that we have not seen. So we're really proud of that. We're really excited to be able to offer that benefit to chamber members. And it's such a strong program. Some people just use us for the savings, but if you ever have a workers' comp claim, it's nice to know that you're working with some of the best. Accident investigation. So this is really important when it comes to third-party administrators. Workers who get hurt on the job have 1 year to file a workers' comp claim. That's a long time. So if an accident happens today, someone slips and falls, and they decide that they're going to go back to work today, and they're going to continue to do, their daily routine. Well, that injured worker, if they decide to wait 2 weeks and they start having back problems and they relate it to that fall, they can file that workers' comp claim still. So something that I really encourage all employers to do is to investigate and ask questions when there is a work-related accident, because you just want to protect your best interest, and it's only going to help us when approving and denying treatment, because we work on your behalf, and having that information is super important. And doing it from the onset of when that accident happened, because if you wait a day or two, it's so easy to forget things. I always relate it to trying to remember what I had last week for lunch. That's really hard. And to remember details of an accident, maybe as simple as just as a fall, would be very challenging. So please, just keep that in mind. I would say too, as a CareWorks Comp client, we have a lot of resources that we can help our clients with. So we have supervisor reports, eyewitness statements, and also a checklist to talk about, who do you need to talk to, when, what kind of questions should you be asking? So those are things that we provide our clients. We can attend hearings on your behalf through the BWC's Industrial Commission. So if there's ever a claim that's protested or goes to the Industrial Commission, we can take those on your behalf. And we have great hearing reps. Their goal is really to mitigate any exposure in a claim that we do not agree with. And so that is their pretty much all intensive purpose, is to mitigate those risks for you and to fight on your behalf. They are non-legal, so they are not attorneys, but should you need an attorney, we would definitely recommend that. But our attorney or our hearing reps can handle about 85% of our cases. So we don't necessarily need an attorney at every hearing. Our hearing representatives have been with CareWorks for a very long time, and they have about 20 years of BWC hearing experience. So they're very well seasoned, and you can be assured that you're getting the best representation in a non-legal setting when it comes to the Industrial Commission hearings. One of the other things that we do as a part of claims management are these cost control strategies. These are great ways to remove cost, stop cost, and keep a claim moving forward, which is exactly what we want. We don't want a claim to get stagnant. We don't want people to be overtreated, because all of that money, all of that medical cost, any kind of indemnity, wages, lost wages, that is all being accounted towards your workers' comp premiums and experience. So that could heighten your premiums that you pay to the Bureau in the future, and most likely will if you have a workers' comp claim, just like car insurance in that sense. So handicaps, these are pre-existing conditions, and there are 25 handicapping conditions that the Bureau that recognizes. And some of the most common ones are like diabetes. So for example, if someone cuts their hand and they're a diabetic, and maybe the hand takes longer to heal because they are a diabetic, the Bureau is going to allow us to file out a portion of those charges. It's basically like getting a discount on a claim. And we want to do that because, of course, those costs that if we don't file them out are going to be going towards your premiums. And when we file them out, that claim looks better. And you're not going to have to pay as much in premiums as you would have. So handicaps are great and a great tool. Arthritis is another big one. Most people over the age of 20 have arthritis. So we always are looking through that information through the medical records. That's something that you get as a TPA when you enroll with us. Lump sum settlements. Now, this is the only way really to shut down a claim in Ohio. So it stops any and all future costs. And there are good times and there are bad times to settle claims, but we would advise you of that. That's a part of our recommendations and a part of our expertise that you get when you work with us. Independent medical exams. Similarly, there are good times and bad times for independent medical exams. There is a charge for independent medical exams, But if an injured worker is kind of stagnant in their care, or maybe treatment is getting excessive, um, independent medical exams are a great way to have a different physician look at that injured worker and make sure that they're making the progress in a claim that they need to be. Of course, you know that we are the employer's advocate. I've said that a couple of times. As your employer, as you're an advocate, we actually look at all of the claims in your experience and try to determine what are the best savings measures. So we have group rating programs. We're going to talk about those here in just a minute, but these are ways to save, and really the only way to save significantly on an employer's workers' comp premiums. So as a part of our services, our rates team is phenomenal, and they have all kinds of analyses that they can do for us. One being a claim impact study, and what that is that if you have a significant claim coming into your experience, maybe you want to project out what that looks like in premiums, because one claim impacts your premiums for 4 years. And that's a long time. So if you want to know what your premiums are going to be projected out for another 4 years with the significant claim in your experience, we can show you that. Salary continuation. If you've ever had a workers' comp claim where an injured worker has been off of work for 8 or more days, you may be familiar with salary continuation. Salary continuation kicks in at the 8th day of an injured worker being off of work. And so the employer can pay wages, or if they choose not to, the Bureau will pay the wages. And so there's some strategy behind that. Those wages that you don't pay, if you're letting the Bureau pay them, those of course are getting added into the overall cost of the claim. So there may be certain times when we want the employer to pay the wages because it's going to make sense financially for your premiums in the future. And then eligibility and alternative rating programs. Again, we're going to look to make sure that we're getting you all the savings programs that you're eligible for and making sure you're aware of that. And then any kind of mergers or acquisitions, our rates team can help you with that. If you have questions about your policy, if you've had an audit and you have findings and you need help with the findings, we'll help you with that. And these services are all included in an annual cost. You don't pay individual for each of these things. These are not a la carte services. It's an all-inclusive program. And something that we didn't really touch on much is that unemployment consultation is also a part of the program. Now, we are not your unemployment representative, but we can help you if you have unemployment questions, which was something huge. We had a huge influx of claims and questions coming into our unemployment department with COVID, and they did a phenomenal job keeping abreast of all the changes that were happening as it relates to unemployment during the pandemic. So just another great reference and resource for you. We're really trying to be more than just, workers' compensation. So, and savings through workers' compensation. So what I did want to share with you is actually the Cambridge Chamber's Workers' Comp program. And so the members that are participating for the 2020 policy year are estimated to save nearly $89,000 in premiums. So that's really nice. We have 2 different kind of programs that we offer. We offer group rating, and the members in that program are seeing a 551% return on their investment. So great program. It's an upfront discount. It is basically rewards employers for not having a whole lot of workers' comp claims. Now, the highest discount allowed in the state is 53%, whereas in the early 90s, it was probably in the 90% discounts. So the Bureau has really scaled that back, and now the highest discount in the state of Ohio that any employer could reach is 53%. And then we have different tiers. So if you don't qualify for 53%, maybe you qualify for a 50 or 49 or 45. We have all these different tiers that we can fit employers in if they have maybe some small claims. And then group retrospective. This has not been around as long as group rating. Group retrospective is typically geared towards larger employers who maybe have some workers' comp claims in their experience. And those folks that are participating in the retrospective program are seeing a 941% return on their investment. The thing about group retrospective, it's a rebate program, unlike group rating, that's an upfront discount. It is a rebate program, and you have to wait 3 years to get the full rebate. So, for example, if you enroll in the 2020 policy year, or if you enrolled in a group retro program for 2020, all group retro programs are not going to have the first payout until the fall of 2022. And you're going to get about 85% of the rebate back that first year. The next year, in that fall, you're going to get about 10% back. And then in the following fall, you're going to get about 5%. So that's a 3-year rebate program. It takes time, but it is a lot more lucrative if you're eligible for the program. I will say right now we are taking evaluations for the Cambridge Chamber's Workers' Comp program. And they're doing a phenomenal job, as you can see. These are evaluations, they're free, they're absolutely no obligation to enroll in the program, but the programs are doing really well. You're partnered with some of the best folks in the state when it comes to workers' comp. And I will say, right now during COVID, CareWorks Comp gives back to Cambridge and your local community for every employer that participates in the Cambridge Chamber's Workers' Comp program. That is hugely important. It is needed right now, especially during COVID. And so if you're interested, please reach out to me. My contact information is going to be at the end of the presentation. But basically all we need is your contact information, so who you are, your email, a mailing address so we can send you a quote, and then also your BWC policy number. So those are the only things that we need, and we can start that evaluation for you. And then I did want to talk about some important deadlines and reminders. So let's start down here since we've kind of gone through the first half of the year. So right now we are in the evaluation phase. We are taking evaluations up until October 21st. That's pretty soon. If you want an evaluation for the Cambridge Chamber, please reach out to me directly and I can assist you with that and follow up with you. The enrollment, so once you have the evaluation, the enrollment paperwork is due back by November 18th. We file our groups the Monday before Thanksgiving, and we need to make sure that we have all the documentation in order to file you on our roster. Sometimes we see that industry groups have changed and things like that. We need new paperwork filled out. It gets very hectic. That lasts probably 2 or 3 weeks of group rating. Now that was for the group rating program. That's the upfront discount program. Group retrospective, on the other hand, we're taking AC3s, or those evaluations, up until January 14th. So continue to submit them in case you're eligible for group retrospective. But the last day that you can enroll into the group retrospective program is January 26th. So it'll be here before you know it, but please keep those deadlines in mind. And I will kind of just go back up and explain that in May, again, I mentioned this earlier, that you actually get a premium installment schedule. So May beginning in 2021, you're going to get your 2021 premium installment schedule. And that tells you when your premiums are due. So make sure you follow that, unless the Bureau has some deferments and things like that they're putting out. Make sure you pay your premiums by the due date. And then June, if you're involved in any other kind of savings programs, you do need to make sure that you are enrolled for the 2021's policy year if you want to be saving in different, not only group rating programs, but in other programs like drug-free safety, transitional work grant, safety council. Those applications all need to be submitted by the June 30th deadline. And then between July 1 and August 15th is the true up. Very important. In order to remain in good standing with the Bureau makes you true up your previous policy year's payroll. They want to make sure that you're paying the right amount of premium for the payroll that you had. And if you have questions about that, it's actually very simple to do it online, but you can always reach out to us at CareWorks Comp and we can kind of walk you through that. But those are some of the most important deadlines. And I'm going to put my contact information up here But of course, if anyone has any questions that's on the call today, I'd be happy to answer those. If you're listening to the recording after today, please feel free to reach out to me. I am a resource for the Cambridge Chamber members. You do not have to be enrolled with us to ask me a question. So please, I want to encourage you to do that. So are there any questions? Okay. I'll give it back over to you, Jessica.
Yeah. So I don't know that we have many questions right now, but that's definitely a lot to chew on and great information. And we'll make sure that we get this out to our membership. A lot of cost saving benefits that you have there. So thank you very much for explaining all of this to us. And hopefully they will take advantage of this and use you guys as a resource for all of the BWC information. So thank you so much.
Absolutely. Thank you.